All right, we are live. Except I'm not live yet. There we go. Hi, everybody. Hi,
Hello, hello.
everybody. I'm Dr. Tenenbaum, and this is Dr. Myckatyn.
Hello, hello. How are you all doing today? West County Plastic Surgeons of Washington University here today, and we are.
Talking to you today about kind of picking an implant or how we help our patients decide on an implant. So, some of this is applicable whether or not this is breast reconstruction after a mastectomy or whether it is an aesthetic surgery. The implant choices really are the same, but how we kind of plan for them may be different between the two. But our goal today is just to kind of educate you all a bit about the different types of implants that are available in the United States and kind of talk about what we use most frequently and go from there. So let's talk about Dr. Myckatyn, kind of the difference between saline implants and then all the different types of silicone implants, because there's a lot of different types of silicone implants.
Yeah, sure. So, thanks for joining us, everybody. Essentially, there are three main manufacturers of breast implants in the United States: Mentor, Allergan, which is now AbbVie, and Sientra. And all of them offer saline and silicone implant choices. So, in general, saline implants are saltwater filled implants. And really, your choices with saline implants are going to be based on the size of the device. So, typically, those implants range from about 100 cc's to about 800 cc's. And then most women choosing breast augmentation or getting breast implants between 250 and 550 cc's. And then there are also options in terms of the amount of projection. So if you look at our table here that we have, it's very nicely set up for you. For the same footprint or width of a breast implant, you can choose breast implants that have a lower or moderate profile, a fuller profile, or an extra full profile. So essentially for the same width, how much that implant projects or sticks out. When you look at the surfaces of breast implants, there are sort of two surfaces. Those surfaces can be smooth and they can also be textured. The different types of textures are associated with the different breast implant companies more than anything. Generally, in our practice nowadays, we have been using smooth surfaced implants, and that is to avoid risk for any complications from a rare lymphoma that can occur with those. So, when you look at silicone implants, again, you can look at them in terms of the different sizes as well as the different projections, just like the saline implants. But in addition to that, the silicone implants come with different levels of firmness of the silicone or the gel that fills them. And so that means you can get breast implants that have a softer gel. You can get ones that have a firmer gel, and then you can get those ones that are in between. Typically, the softer gels do tend to have more ripples than the firmer gels. The firmer gels, because they're a bit more stable, though, can also often help to shape the breast a little bit more and help with things like projection or getting better fullness in the upper pole of the breast. So we will definitely consider the gel fill in terms of kind of what we're trying to achieve with our patients.
Yeah, and I would say that along the lines of that gel fill, so we also think about it. Was talking about kind of softness and firmness, but it also, you'll hear the term cohesive or cohesivity, which means how solid the gel is or how cross-linked that silicone is. So, sort of the most solid or most cross-linked gels we refer to often as Generation 5 or Type 5 gel. Allergan and Sientra use Type 5 gel in some of their different silicone styles. You've probably also heard about gummy bear breast implants. That's really referring to kind of that more firm or more solid gel. So if we took a knife and we cut one of those implants in half, it's very solid on the inside, kind of like a gummy bear. Whereas Generation 4 gel, if you cut that in half, it's still solid, but I like to say it's almost more like Jello. It's solid, but it's a very soft solid. Um, all implants can rupture, but a rupture, I would say that term is probably most applicable to a saline implant, because when a saline implant ruptures or leaks, it deflates completely. A silicone implant, because, especially type 5 gel, because it is solid on the inside, a rupture is more like a fracture or a tear in the shell. But in general, all of the gel kind of sits together on the inside. So that's good, but it also means you can't necessarily tell that something's going on, and your surgeon actually may not be able to tell. And so we do recommend screening of implants. The current FDA recommendations are to get an ultrasound of the implant at 5 or 6 years after implantation, and then every 2 years after that. And that's whether it's a reconstruction or an aesthetic surgery. And that's just to check on the implant to make sure it is still intact. And then I just wanted to make another point about kind of these different projections. So this particular brand comes in actually 5 projections: low, low plus, moderate, full, and extra full. So right here I have a low plus, a moderate, and a full. These are all basically the exact same volume or size. They're all about 300 cc implants, but you can see the low plus is a lot wider and less projecting compared to the moderate, compared to the full, more narrow and more projecting. So this is something that your surgeon should really be instrumental in helping you choose, depending on your body, kind of the dimensions of your body. We call that dimensional planning. In my opinion, that's the most important, rather than saying I want a particular volume. To me, it's most important to kind of look at your chest shape and figure out how much native tissue we are dealing with versus what we want to make up for with an implant in terms of the width as well as the projection. Once we have those 2 measurements, by default, you have a certain volume. So rather than starting with a volume, I like to start with those dimensions, and I think it makes for a more natural result that's longer lasting. Yeah.
Yeah, and you could also consider, in addition to the dimensional planning, we'll also offer like 3-dimensional imaging or 3D simulations. And so when we do that, essentially patients get a 3D photo done in the office, and then we can simulate what their breast augmentation can look like for them. And so we can literally virtually place these different implants. And that does give you, I think, a little bit of a sense of what you can generally expect with the look. Oftentimes people want to know what's the space going to look like between my implants, where is my nipple going to be positioned if I just get a breast augmentation. And so the 3D imaging does help a lot with that. It's not perfect, but I think it's a really valuable tool, and I think a lot of our patients really appreciate getting that as well.
Absolutely. And I would just say that that's a lot more valuable for augmentation, women who are seeking augmentation, as opposed to women who we're doing more reconstruction on. I don't think it's as valuable for that.
Yeah, absolutely. If you want to decide if you're going to get a breast lift or not with your augmentation, they can be really valuable for that as well.
Absolutely. And that's a whole different topic, but yeah, sometimes we do other procedures with implants, like a breast lift, where we do need to reposition tissue and nipple position, and an implant only is not really going to help us achieve our goals, or frankly sometimes can look odd if somebody really needs a lift. Placing an implant alone can look really strange sometimes. Or sometimes adding other factors such as fat injection. So again, a whole nother topic that we've talked about before and we'll talk about again, but sometimes along with the implant volume, we may add fat volume to help with extra volume, as well as camouflage and helping it to look more natural. I think that is sort of what we wanted to cover in terms of giving you a rundown. Saline versus silicone implants. I will just add that I rarely use a saline implant. Occasionally I'll have a patient that really prefers a saline implant, but I feel that the newer, more cohesive type 5 gel implants look and feel a lot more natural, a lot softer, and they ripple less, and they're quite sturdy. No implant is a lifetime device. We're very careful to tell every patient that no implant is going to last forever. It does require screening and will require removal or replacement or revision typically at some point. Everybody always wants to know how long, and that is a very big range depending on the reason you're doing a revision. If we're simply talking about something going wrong with the implant, like a rupture, that may be 15, 20, 30 years. But often other factors come into play before that, like wanting a size change, needing or wanting a lift, malposition of the implant, needing to reposition, etc. So it's really also critical to know that once you've started down this journey, often it is more than one surgery over the course of your lifetime. And that is also why planning that implant is super, super important, because we are not just concerned with you looking great in a month after surgery. We want you to look and feel great 10 years after surgery, 15 years after surgery. So when we're talking about kind of an appropriate size, footprint, projection for your body, I'm thinking about your current goals, but I'm also trying to think about how is this going to age and how is this going to look, 10, 15 years from now. And I think that's really important and something really important to discuss with your surgeon.
I could not agree more with that sage advice from Dr. Tenenbaum.
That's right. He's so smart.
Yeah.
Just agree.
Yeah, just agree. It works really well.
Really well.
So, no, but as I say, I think that, or as Dr. Tenenbaum said, I think that pretty much sums up, the options again. I think it's just really important to, when you do see a board-certified plastic surgeon and you're considering breast augmentation, to go in there informed, ask a lot of good questions, and hopefully this presentation will arm you with some of those questions as you explore this further.
Absolutely. So I think we got all of your questions answered that you sent in ahead of time. But if not, please go ahead and leave a question, and we will do our very best to answer it as quickly as we can. All right. Thanks,
Stay
everybody.
safe, everyone.
Have
Be
a
well.
great rest of your week.
Thank you.
Okay, so if you want to
Do we hit end live video? Yes, there. There's a question.